Good morning, everybody, and welcome to Cluster 1, Destination 1 session focused on staying healthy in a rapidly changed society. My name is Carmela Plaza, and I am the head of units of Health Innovations and Ecosystems in DG Research and Innovation. I will have the pleasure to moderate this session where you will have the opportunity to ask questions in the topics that are going to be funded in 2021 under this destination. The overall objective of Destination 1 has a focus on preventing diseases. Research and innovation under this destination will aim at enabling citizens to live longer and in better health. Ensuring a healthy life starts in early childhood, and this is why across all stages of life, birth, infancy, childhood, adolescence, pregnancy, mature, and late adulthood, and in all health conditions and needs, citizens should have access to tailored health solutions, including solutions to help achieve and maintain healthier behaviors and lifestyles, as well as well-being. Furthermore, as people's health can be impacted by rapidly changing society, it becomes increasingly challenging to keep pace and find our way through new technological tools and societal changes, which both are increasing pressure on the individual's resilience. A video is available in the InfoDay website containing more information about this destination and also about the topics that will be funded in 2021. Today, we will focus on 3 topics with an overall budget of 66 million, 1 research and innovation action towards a molecular and neurological understanding of mental health and mental illness for the benefit of citizens and patients, and 2 coordination and support actions, supporting digital empowerment and healthy literacy of citizens, and a roadmap for personalized prevention. Before we start with the questions, please note that under Horizon Europe, there is an increased emphasis on the expected outputs, and the expected outcomes. You will see under each topic the description of the expected outcomes. It is very important that you always keep in mind who would be the user of the results of the expected output generated by your proposal, as this is how you will generate outcome. Very important to keep that in mind when you are writing your proposals. So now we are going to open the floor for questions, the questions that you might have on these 3 topics that I mentioned earlier. I don't see any question coming. Okay, I see a first question is coming on the topic supporting digital empowerment and healthy literacy of citizens. The question is asking whether the project is open to involvement of public health or educational institutions, and I will pass the floor to Irina Calderon, who is the topic leader.
Hello, good morning, everybody, and thanks a lot for this question. Yes, definitely the topic is open to any public health or educational authority or institution. In fact, it would be very important to involve also public authorities because they are very often the primary provider of education and of skills. It is also very good to know exactly what are the difficulties that they face when there is lack of health literacy, and how good digital technologies and tools could help them. So yes, also they could also serve as interesting use case, which is one of the scope also of the code to have a particular best practice or champions that are very good in providing digital skills. yes, the question is definitely positive. The answer. Thank you.
Thank you, Irina. Let's see whether more questions are coming. In the meantime, maybe I can pass the floor to Dirk, who is the topic leader of the Research and Innovation Action towards a molecular and neurobiological understanding of mental health and mental illness, so that he can give some more indications about the topic itself, because before we receive further questions. Dirk, the floor is with you.
Yeah, thank you, Carmen. In fact, the mental health topic is very broad, is covering quite a lot of different aspects. But this goes in hand. Of course, mental illness also represent a very huge and growing burden for Europe, and there is a lot of complexity that we have to discover. So there is an interplay between all kinds of different factors, resilience factors and risk factors, that we have to look at. We want to see more biomarkers and more evidence. And what is maybe important for this topic is that we have in the scope, you will see that there was 5 different areas that we mention, and we do not expect that a proposal covers all of the 5 different areas at the same time. It would be too comprehensive, but you should at least deliver on several of the areas. So one area is, for example, molecular and neurobiological understanding, looking at the resilience factors and so on. The second area is about cohorts, so to analyze the cohorts and to develop models. And the third area is about biomarkers. We have also described a little bit what kind of biomarkers we want to see. And the fourth area is about the disease pathways and drug targets. And the last, 5th area is about the effects and consequences that should be looked at in clinical trials. 5 quite different areas. The applicant should try to cover several of them, and it's also important that in the best way we would see maybe around 6 projects for 10 million each, and we would expect networking between the 6 areas so that we really cover the full range of all the mental health challenges. So we would expect the 6 projects to think about in advance already, to think about joint workshops and to have a budget included in their proposal so that they are prepared to work together and to cover altogether the full scope of the mental health topic. Thank you.
Thank you very much, Dirk. Maybe we can move now to a question that came on one of our coordination and support actions, in concrete on a roadmap for personalized prevention. And the question is whether the project should lead to a strategic and research agenda. I pass the floor to Jean-Luc San, who is the topic leader of that action. Thank you, Jean-Luc. The floor is with you.
You hear me well? Yes, this is a coordination and support action that means that creating conditions for the implementation of personalized prevention in practice, because we know the advantage of personalized medicine, but so far the focus has been more on treatment than on prevention. So we would like to understand what are the bottlenecks, the reason why prevention is not so developed. And so this is the purpose of this project, which is to create a community, analyze, understand, and propose a research and innovation agenda so that it will be support to future research funding actions from research funders. So yes, I confirm this is the one of the objectives. It's among the expected outcome of the project, and I recall that proposals have to address all the expected outcome listed in the description of the topic. Thank you, Carmen.
Thank you, Jean-Luc. So the next question that I see in the Slido is addressing the research and innovation on mental health. And the question is whether the involvement of patient or citizen groups is mandatory. Dirk, this question is for you.
Yes, of course, it would be good to involve citizens, and we need to see a citizens' engagement, and the project should, this is what the topic is saying, the proposals should ensure strong involvement of end users, including citizens and patients.
Thank you, Dirk. I see a next question on the roadmap for personalized prevention, coordination and support action, which is asking whether the proposal should cover a single chronic disease or more.
Yes, well, actually, this topic is not oriented toward a specific disease. So it's not also a research project. So there is a possibility for the proposers to focus on one disease so that they can create a community of interest in this domain, identify the bottlenecks, and come to proposals to implement and advance personalized medicine in this domain, like, let's say, cancer, for example. But they can also have a more holistic approach and consider, I would say, horizontal dimension that can be addressed also in this topic. So there is no need to focus on one disease, but it's not forbidden to, let's say, approach the problem through one disease. It's left to the opinion of the proposers. Thank you.
Thank you, Jean-Luc. There is a next question that arrived, which is targeting, again, the topic on mental health, and is asking whether the scope is only neurobiological and whether could increases in the efficiency of therapeutic practice come under his topic. This question is for Dirk. Thanks, Dirk.
So the scope of the mental health topic is covering 5 different areas. One is about the molecular and neurobiological understanding of resilience factors and so on. And the others are, as I explained already, it's about cohorts to develop biomarkers and drug targets and clinical trials to assess the effects. So, in particular, the first area is about the molecular and neurobiological understanding. And it's important that the proposal covers several of the 5 different areas. So not all of the 5, but several should be covered.
Thank you, Dirk. I see a question now on the coordination and support action on to empower the citizens. The question is about whether the project should involve also policymakers. Irina, the floor is with you.
Thank you. Yes, again, the reply is definitely policymakers should be involved in this action, or at least the results and the whole process of this coordination and support action should be disseminated to policymakers, because the objective is, of course, to map health literacy and health literacy research and levels in the EU. But also to develop a strategy that could be implemented across the EU. So indeed, policymakers are integrated part of such a strategy development. The third thing is that the action aims also to create a network of champions and of best practices across the EU when it comes to health literacy research and to health literacy practices. Then very important again that policymakers are made aware of such a network, that exchange of these best practices is stimulated across the EU between different regions and member states. Yeah, so that's it. Thank you.
Thank you, Irina. Next question is targeting the topic on mental health and is asking about biomarkers. Regarding biomarkers, the question is it expected to address all purposes, Dirk?
Yeah, in principle, we want that biomarkers for all of the listed purposes are developed. So there is 4 different kind of purposes that we mention here. It's about measures, the identification of signatures, and also about diagnostic monitoring criteria, and the treatment response and risk of relapse. So these are the 4 different purposes that are listed here in the topic, and all of them should be covered here.
Thank you, Dirk. There is another question also targeting your topic, which is asking about the selected projects that would be supposed to work together. And the question is whether the portfolio approach will be used to select those 6 projects. Well, 6 projects, this is just indicative figures, obviously. But will the portfolio approach be part of the selection?
The selection goes, of course, independently. Every project will be evaluated according to the criteria, and then they are all expected to include already a networking budget for joint workshops before, but this should be further defined afterwards during the grant agreement preparation.
Thanks, Dirk. Next question now, it is addressing the topic on the empowerment of the coordination and support action empowering the citizens. And the question is about the target for this call. Is it patients or public administrations, Irina?
The target of this call is all EU citizens. So, of course, patients, citizens are the main target, meaning that we want to make sure that patients and citizens can use digital technologies, or that they are for their better health. But this goes also through of course, targeting the administration, because this cannot go separately. So, in fact, it is important to target citizens. It is important to target, of course, patients, but of course public administration as well, because they are often they have the role often to supply such digital health literacy courses or trainings, for example. So of course they should be targeted. So any actors that should be involved, also the industry, also researchers, also of course academia, and people coming from the educational sector should all be targeted in this section. Thank you.
Thank you, Irina. There is another question for you about the development of digital platforms regarding health literacy. Is precisely the development of these platforms allowed in the project execution? Well, we have to keep in mind that it's a coordination and support action. But Irina, I leave you the floor for the answer.
Yes, I think you said exactly the what is right. Indeed, it is a coordination and support action. A development of a platform is allowed, of course, but this is not the main objective. One could use such a platform, for example, to exchange best practices or to showcase them. But it is more of a tool that could be used to support this action and this dissemination activity that is intended to be done across many member states and many regions. So yes, a platform could be used, but this is not the main objective of this action. Thank you.
Thank you very much, Irina. Maybe let me just comment that today we are, as I said in the introduction, and as it was said in the general session of this morning, we are only discussing about topics in 2021. Topics of 2022 can be addressed in future Info Day sessions and can always be asked into written and will be part of the frequently asked questions that will be displayed in our website. By that, I also take advantage to answer one of the questions that is appearing in the Slido, which is whether these questions will be added to the frequently asked questions. And I can say that yes, they will be. All questions that are asked in all the topics, in the different settings, in the different consultations and information sessions we are organizing, will be added to the frequently asked questions so that they are available for everybody. So I see a question on the topic on mental health, which is asking, with reference to topic 0102, is it anticipated proposals to take a medical pharma approach as opposed to a psychological approach?
Yeah, it's important to note that the scope of the mental health topic covers 5 different areas. And one is more about the drug targets and the involved maintaining of mental health and the effective medications. But the other areas are quite different. And for example, development of biomarkers or analyzing data from cohorts. But in the end, a proposal should cover several of the 5 mentioned areas, and not all of them are required.
Thank you, Dirk. Next question is on the topic 0103, how to empower citizens. And the question in concrete, is the goal to define policies, managerial implications to digitally empower citizens? Is that the goal, Irina?
Could you please repeat? Is the call?
Yes.
Yes.
The question is addressing whether the goal of this topic is to define policies, managerial implications to digitally empower the citizens?
Yes, of course. So it is a call to define policies, to define a real health literacy strategy on European level. And of course, it includes also what policies should be put in place in order to support the use also of digital technologies to better support and empower citizens and patients throughout life, so young and old, from any age and any background. Yes.
Thank you, Irina. Next question. It's for the Mental Health Research and Innovation Action, and is asking, is a very wide range of diseases, is addressing the fact that mental health is a very wide range of diseases, psychiatric, neurodegenerative, neurological ones. Should all types of diseases be targeted or several?
I would say, yeah, it's a broad range. The mental health is a broad range, and we want to see very multidisciplinary proposals. It's quite important to see scientists from different disciplines to get involved in this, and then the evaluators will, in the end, decide what is the best coverage, and if a proposal can cover quite the range of disciplines that we want to see, then this is very good. And if it's too narrowed, only dealing with fewer disciplines and covering not so much of the mental health, and this is of course not so good.
Thank you, Dirk. Next question is also for your topic. It's asking whether a project to validate an alcohol consumption biomarker would fit with this topic.
Concerning biomarkers?
So an alcohol consumption biomarker.
Without what?
No, whether the validation of an alcohol consumption biomarker would fit the topic.
Well, this is a very specific type of biomarker, and it's of course covered, but the applicant should really carefully look at what we want to see here. We want to see the identification, the validation of different types or combinations of biomarkers for 4 different purposes. And there is a list also of the 4 different purposes, and all of this we would expect.
Thank you. I have another question on whether mid-caps or large corporations can participate in this destination. And yes, of course, any kind of corporation, whether big or small, is obviously authorized to participate in Destination 1, and the same applies to all the destinations, with the exception of some very specific topics that are targeting, for example, national contact points. In general, all beneficiaries all potential beneficiaries are accepted in the different topics and destinations. By the way, I didn't mention at the beginning of my introduction that there is also this coordination and support actions to support the network of national contact points. Obviously, we are not addressing it today in the round of questions because this is very specific, and the target of this destination is precisely the national contact point, so there was no need to discuss about it. I don't see other more questions for the time being.
Amen.
I see another question.
Any question? If we don't
I
have any
see.
question, I would like to make a comment because very often people are asking whether one thing is possible or not within the topic. The principal rule is that if it's not explicitly say you have to focus on this, you can always enlarge and then you justify in the proposal. It's not, the idea is really to read carefully the topic, which is the legal basis. Whatever we say, this is the topic that is right, the way it is written. And proposers may find some room for interpretation as long as it's not clearly forbidden. There is still a possibility to enlarge a little bit, but then we have to justify and convince the evaluators.
Thank you, Jean-Luc, for these general comments. Maybe let me answer to two new questions that have come up in the chat. One is asking about the budgets and how the budget should be understood. And as it is specified in the work program, budgets are only indicative. So this is what we have estimated as necessary budget in order to perform or to address the different scope of the topics. But obviously, it depends on the concrete scope and range of activities that each specific proposal will do in order to target, in order to achieve the expected outputs that the budget will be determined. So that's why the budgets we are mentioning are only indicative. There is a question on destination 1 and 3 that have common issues, the quality of life for society, citizens, and patients. And then it's asking whether the effects of sport on diseases would fit better one destination or the other. I would like to say that there is, of course, all our destinations do target the challenges that from a healthcare perspective, our society is confronted to. So it is difficult to attribute specific things to a concrete destination, and more in particular, as concerns the effects of sports. Obviously, I think that everything would depend on the scope of a concrete proposal. If the effects of the sport have an important relation with the concrete output the project is going to deliver, I think that they could absolutely be relevant for both destinations and potentially for any other destination as well. As I explained at the beginning of the presentation, what is important is that you think about how the specific proposal you are preparing is going to translate into outputs that by being used by the specific users will deliver the outcomes that ultimately will help achieve the long-term expected impact that are described in the destinations. So in this context, there is no specific and only approach that would help deliver this specific output. So it's important to have a kind of broad perspective and to just think about how can I contribute to these expected impacts through what is indicated in the scope of this topic. So I don't think that the effects of sport would be more targeting one or another. It is clear targeting destination 1, but depending on the topic of destination 3, it could as well. There is now another question in the chat. Is exposure to heat waves from a public health perspective considered as relevant to this topic? Should the proposed research include clinical research as well? I don't quite understand which topic is it referring to. It is not mentioned, so maybe if whoever asked that question can precise the topic, and in the meantime, I will go to the next question in the chat, which is in the slide, which is targeting the empowerment of the patients coordination and support action. And the question in concrete is, what are the key assets that will be looked for in the coordination of this action? Irina, please, this question is for you.
Well, that's a very good question. In fact, what is really important is the involvement of patients and citizens also in the co-creation and of such a strategy to and in the use of digital technology. So involving citizen patients in understanding what exactly are their needs and also how they could be supported. Important to involve any actors, as previously said, that are relevant, whether those are innovators, whether those are authorities, policymakers, academia. So really very broad involvement in this CSA. Clear asset is also the possibility to reach out to as many as possible European regions. It's very important that all member states, all regions are included in this CSA when it comes to disseminating and exploiting its results, but also to not leave behind regions and member states that are often left behind when it comes to these aspects. Clear asset is, I would say, also the completeness of this strategy on European level that would enhance digital health literacy for citizens, independent from their geographic or social or any other background. So the broad involvement of everybody.
Thank you, Irene. Thank you, Irene. Thank you, Irina. So I have a next question here, targeting the call on mental health, the topic on mental health, and is asking whether there is a place for early developments of e-monitoring technologies and first acquisitions of preliminary data on patients. Dirk, can you address this question?
The idea of the mental health topic is to cover the full broad range of all the areas that I have already mentioned several times. So it's not enough to be very specific and limited, covering only one kind of discipline or imaging or monitoring of mental health. It would be important to cover several of the areas that are listed in the scope. And of course, in the end, the evaluators will decide what is the most excellent proposal, what is covering the scope in the most excellent way.
Thank you, Dirk. So I don't see any more questions for these specific topics. So maybe we still have a few minutes, 5 minutes, where we could still have questions coming. Well, actually 2 minutes, because in 5 minutes precise, we have to close the session. So maybe I will just reiterate the importance of this change of intervention logic that is very important in Horizon Europe. As I said at the beginning, impact is the main, I would say, is one of the main words that would characterize the novelties of Horizon Europe. And I think it's important that when you prepare your proposals, you have this aim to achieve impact very present. So again, please very carefully consider when you are preparing who would use the outputs that your project would deliver, because it's only by considering that ultimately we can achieve the impacts that we are looking for by the funding of the different topics in this destination and in the others. So please always keep that in mind when you are preparing your proposal. I don't see any more questions coming. But as I said as well, okay, I see now a question is coming on the mental health topic that is asking what are the key assets that will be looked for in this action, in this research and innovation action. And a second question on this mental health topic, asking whether we will see similar goals in the next years of Horizon Europe. I think that, sorry, Dirk, please go ahead.
Yeah, in the year 22, we also have a mental health topic to boost this area. It's mental health problems are growing, and it's a big burden for Europe that we have to deal with. And the proposals should cover a broad range of disciplines, and they should undertake basic research, but also analyzing data and clinical trials. It's really a broad range that needs to be covered here. And we have to see, of course, it depends on the competition, how this is going, what in the end the most excellent proposals, the 6 most excellent proposals will be that we can fund.
Thank you very much, Dirk. I just have to, well, we cannot accept any more questions because we have to close the session because the next destination is going to start. But again, as I said at the beginning, please don't hesitate to send us further questions. There will be the frequently asked questions recorded and available in our websites. This session is recorded, so you can access it later on in case you would want to hear again the answers to some of the questions. And before finalizing, let me thank you, our public, for your engagement and interaction and your interesting questions. And let me thank the other speakers for having contributed to the answering of these questions. Thank you, and please keep engaged with us through the participation in the other destinations that will follow during the day. Thank you.